Hello, everybody. Welcome to another episode of the Beyond Terrain podcast. Uh, this is going to be a cool episode, guys. I'm really looking forward to this. We're going to talk about a topic that we haven't really touched on too much today. I think it plays an important role. I think we'll be able to tie it into a lot of topics that we have been talking about. Um, I think I found the right guy to talk about this as well. I've been kind of trying to find someone to dig into kind of the um, vagus nerve discussion. And, I'm not well versed enough in it, but I think today we'll get a great overview and maybe go into a little depth here and see if we can connect it back to the topics we've been talking to. This guy's great. I listened to a couple of his podcasts with other people like Daniel Roytus. They have some, I think, two great episodes together. Um, yeah, so we have Emrys Goldsworthy on, guys. Emrys, thank you so much for coming on.
Thanks for having me. I'm really looking forward to it.
Yeah, me too. So I always ask at the start an introductory question. What is health? And this is kind of like
Mm.
what health means to you. What does it look like? How does it manifest? And this also always gives us a good baseline on moving forward. So what does health mean to you?
I think, uh, yeah, that's a very difficult question. Um, I think when we use the term health and also even disease, I think we run into some problems. I think we're looking at this like in a very binary way. We're either in health or not. And I think the best way to kind of explain what health is in two ways. One is how it feels, but also how it probably is in the body. And for me, we will get onto the vagus nerve today. It's probably a big part of this explanation. But health is where your body is in its optimal state to detect, capture, and eliminate toxins efficiently and without too much harm to the host or to the organism, us. We as much as we can, stay out of trouble as far as trauma is concerned, although a little bit of discomfort, a little bit of difficulty in our lives makes us stronger and more resilient. So I think that's an important part of being healthy. And as much as we can, achieving this is a very difficult thing in this world of new biology and terrain because we don't really know exactly how digestion works and absorption of nutrients. But let's just say we get what we need from our environment in order to thrive. And thriving goes back to being able to achieve our goals. You know, our main two goals are to survive and to procreate. I do believe that. I know it sounds a bit banal to just talk about it in those two ways, but we're going to get on to the autonomic nervous system today. And I think the key is a healthy, really efficiently functioning autonomic nervous system that will basically give us the keys to being able to quickly identify and eliminate toxins. Then how it's perceived is difficult because I actually think in many ways people who are getting colds and flus are doing the right thing. Their body's doing the right thing. They are actually healthy. I don't think that that's unhealthy. Constantly being sick doesn't mean that you're unhealthy. It just means that your environment is not good for you. Or there could, and I will talk about it today with the vagus nerve. I really do believe that people who are in the wrong environment and don't get sick are actually less healthy because they're not actually eliminating the toxins in their body, and that can lead to further so-called quote unquote diseases that are further downstream, just failures to eliminate. So I think that it's a bit ambiguous. I can't. I've heard. I actually listened to Daniel's podcast and I heard his explanation. I totally agree with everyone's explanation generally, but I think that that's what I would add to the kind of landscape of what health means. And I think some people do also obsess with what like trying to be healthy, whereas they actually don't know what healthy really feels like. And sometimes it's contrary to what they feel is good. You know, like the classic one is someone has a corticosteroid and they feel like they are really healthy, but of course they're not they're very unhealthy at that. But the perception of health is very deceiving. And I think that that's something I've been trying to teach people. I run of groups on social media to try to educate people on this, and it's a rough world out there. There's a lot of very, very indoctrinated people, and they're not willing to give up that ideology of what health is to them. But I think we'll get there one day. I think with many of them, it's not really an answer. I think that there is no one answer, but I think that's my 2 cents of it.
Yeah, well, if anything, this podcast has proven that everyone has a different perspective on what health is, right? We've had a
Yeah,
very different answer. This is episode 21. We've had a different answer for every episode, and I would answer it differently.
there you
And
go.
I'm sure that every single guest that I'll have on will answer it differently as well. And um, I think, yeah, like even just how, even what you're indoctrinated with, right? Even if it's not like classical indoctrination, but even what your focus is, right? You're gonna tailor that definition to what you're focused on too. And Um, but no, I really appreciate your perspective, especially like I think a great point that you made was that just because you get sick doesn't mean you're necessarily unhealthy, right? This is a
Yeah,
cyclical part of nature as the seasons move and the leaves fall from the trees. If you want to consider that a disease, that's essentially what's going on in our bodies, right? We're shedding our leaves once a year, right? It's like a cyclical part
and
of nature, I think. And you said that the indication is more so an unhealthy terrain, and I think that's good as well. That's a great perspective. If you're constantly sick, every month or 2 months, right? Maybe that's not the cyclical nature of our detoxing process, but maybe that is a better indication of, you need to change up your terrain. And
mm,
um, you said beautifully that if you're not actually getting these detox symptoms, disease, whatever you want to get, the flu, right? If you're not getting that, that's going to be problematic down the road. I always kind of thought that, whenever you stop getting sick all the time is when you start getting chronic illnesses, right? And,
mm.
um, if you're not actually going through these detox periods, then it will build up in the body. And um, I think that's really, really important. I think that's a great note. And, symptom suppression is another part of it too, right? If you're going to have symptoms and then suppress them, that also leads to more chronic illnesses, I think.
But you're pushing it to another time, or to another way,
Yeah.
and you could say that's what cancer is. You could say that's what all these different really, really chronic health conditions really are in different ways. And I really want to add my 2 cents about how the vagus nerve is involved in that. But coming back to just generally detox, a lot of people during this COVID-19, whatever you want to call it, real or not real event, um, I'll just call it hysteria. There was many people who were hospitalized. Maybe there was a bit of psychogenic illness involved. Without a doubt, there would have been. But there's this phenomenon you do hear about where people so-called die of a cytokine storm. This sort of overwhelming effect of pro-inflammatory cytokines. And I wanted to just mention that because it's something that I've been getting my head around, like what really is a cytokine storm from my perspective, not from the medical perspective, because I don't see cytokines in any way as being harmful. Zero harm. There's no experimental
Mhm.
study where they inject cytokines into someone that are like human cytokines in the right context that causes harm. This just doesn't happen. Just like with viruses and bacteria and things like that. If you disturb the solution enough, you're going to eventually create some level of disease or discomfort in the person. But truthfully, cytokines are not toxic; they are messengers. So when you hear about, look, my inflammation's really high, it just often is reflected in their C-reactive protein, which is analogous to interleukin 6 or interleukin 1 beta or TNF alpha, the more prevalent one that's talked about, TNF alpha. And one of the things that I would say with this is that as someone's getting sicker and sicker, they're not getting better. Remember, this is disregarding the effect of the drugs they're on, because that's a whole other thing. The TNF alpha interleukin 1 beta tends to rise and rise and rise and rising higher and higher and higher. And often they'll say it gets to the point where their whole body just shuts down from that, trying to fight the virus. It's sort of as if TNF alpha does that, which it doesn't. The TNF alpha is like a communication between so-called immune cells in the defense of the system, they would say. Of course, I see it as a toxic problem. Just remove the word virus and put in toxin. And there you have the problem. Someone has actually got has toxin exposure. They're not well equipped to deal with it, mind you, more than likely. They have all those comorbidities, which come back to the same common denominator. And I'll explain the vagus nerve in relation to that today. But then a bunch of things happen to them which may make this whole process worse. But generally, their body is trying to communicate, to eliminate. And it does that. This communication of, we've got to get this out, we've got to get this out, we've got to remove this, we've got to remove this, through its system of different cells and different structures to eliminate neurological and quote-unquote immune interfaces. It needs to keep communicating this if it's failing to do so. If it's not actually eliminating through all the different pathways, which I'd love to talk about, it will eventually just keep raising up that cytokine level, which looks bad on the bloods and is reflected in the severity of their condition. They are getting worse. They're not getting better. And their cytokines are going up. And they put those two together, that classic fireman at the fire. Oh, look, there's more firemen at this raging fire. Every time another fireman comes, the fire gets worse. Yeah, well, it depends on the order in which you look at it. Fire gets worse, more firemen come. And that's in a way what's going on. But it's actually the fact that the body is not eliminating. There's not adequately eliminating. So therefore, it will keep trying to initiate that response. And it fails to do so. And therefore, it keeps rising. And I think that's the reason why we see these so-called cytokine storms.
Awesome. That's amazing. Yeah, something I haven't really even thought of before. That's amazing.
No.
Yeah, yeah, super cool. Great explanation too. Um, so maybe now's a good time. Get right into the
Yeah.
vagus nerve. Maybe just give your little introductory spiel. What is the vagus nerve? What is vagal
Yeah.
tone? Maybe dysautonomia. Whatever you think's necessary here. I'd like to just give you the
Yeah.
floor to maybe kind of introduce the topic and tie it into what we were discussing just there. And
Mm-hmm.
yeah.
So look, the vagus nerve is cranial nerve 10, and it's part of the 12 cranial nerves that come out of our brainstem, particularly an area called the medulla oblongata. It has a bunch of areas where it produces neurons or nerve cells called nuclei, and there's 4 main ones. There's ways of dividing that are known in the popular media. But generally speaking, the best way to explain it is that 2 are output and 2 are input. So they receive information and put out information. We'll get to that if we need. Then there's pathway of the vagus nerves. There's actually more than one, of course. There's one on each side, but then it divides into lots of different nerves. It goes into the back of the throat to elevate our uvula, to give rise to taste receptors at the back of our tongue, also to assist in swallowing. It has innervations to our larynx so we can speak. So often an effect of having a problem with their vagus nerve is having changes in vocal tone, hoarseness of voice, loss of voice, things like that. Loss of swallowing, reflexes, things like that. Loss of taste is another one, particularly bitterness. And sometimes umami flavors get lost. And then as it further goes down, it also, before this, it divides into what's called a cardiac vagus nerve and a cervical vagus nerve, which essentially is just everything else. And it goes down into our organ systems. Lungs, it innervates the lungs. It goes to the heart. It changes the heartbeat, the rhythm. It can affect how much contractility is in the heart and also how much blood pressure there is at any given moment. We'll get to that. Its effect on the lungs is pretty cool. It actually is incredibly important for detoxification of the lungs. So I will mention that now because we're on it. So in the lungs, you have these things called irritant receptors. So when you breathe in something toxic, whether it be smoke with particulate matter in it, or it might be any number of other things, your body is generally pretty well tuned to what is toxic to our system, and it will initiate a cough reflex pretty early in as it comes into our upper respiratory tract. And that upper respiratory tract is vagal sensory irritant receptors. They are vagal and they are going to respond by a cough. And that's appropriate responses. Some people don't. And therein lies one of the problems. From the first problems is they don't cough and they don't initiate elimination. So if their vagus nerve has a problem, sometimes you'll see a poor cough reflex, insufficient cough reflex. The other thing that happens during this time is that mucus is produced. And mucus is produced in the back of the throat, in the lungs, and those goblet cells are innervated by the vagus nerve. Again, part of the same system, but it's the next line. So we're going to then send out mucus to capture these so-called toxins, which they are in this context, and not the bacteria, not the bacteria. It's or the so-called viruses. No, it's our toxins. And then our lungs are really cool. They have these things called hair cells. And they're like little projections. They're like little hairs. And they have a little contractile element that goes, oh, contraction, contraction. And every time it contracts, it flicks. And it flicks mucus upwards towards our throat against gravity. Obviously, it's a lot easier to cough out mucus if we're lying on our, like lying forward. And it will, due to gravity, it allows it to come up to the throat and we cough it out. As gross as that is important to eliminate toxins, first line elimination pathway of the lungs. And it's all vagally mediated. That flicking is a vagal input. And then the other thing that it does really cleverly is it actually constricts the lungs. So you get like asthma-like symptoms, bronchoconstriction. And that's to protect your lungs. So when you breathe in a bit of smoke or something like that, your lungs go constrict and they don't allow for the absorption as much as possible. So you don't feel good. You know, you feel pretty crappy at that point, like you've got asthma and you're coughing it up. This is appropriate, by the way. None of this is bad. This is all appropriate for the situation. But what's inappropriate is not getting that. So, I can breathe in all sorts of smoke and I don't get any, negative effects from it. Oh, well, don't you? I mean, that's the truth is it's this lying in wait kind of toxicity. It's getting through the side door. It's not able to deal with the front gate, so it goes through the side door, and our body doesn't have good defenses at that point, truthfully, because we're so obsessed by the bacteria and the viruses that we just forget that mostly people are getting sick because of these toxins and their inability to recognize them. Further down, the esophagus is innervated by the vagus nerve, so the contraction of that esophagus to push food through down to the bottom of the esophagus at the lower esophageal sphincter. As pressure increases lower down, the esophageal sphincter opens and relaxes. As the pressure increases, the food going through that esophagus and that slow esophageal sphincter, and it releases it, there's no more food in there, it closes. But if you have a dysfunctional vagus nerve, it wants to not close properly. And that is one potential cause of reflux, is that the vagus nerve is not adequately closed that lower esophageal sphincter. In the stomach, I hope this is okay, it's a very long explanation. In the stomach,
Please,
food
go
is
ahead.
then stimulating locally and when you are eating. When you're chewing food and you're tasting it, you're stimulating your vagus nerve, by the way. When you chew food, the longer you chew, the more you stimulate your vagus nerve. The more you taste your food, the more you smell your food, things like that. The slower you eat. And then by the time it gets to the stomach, there's already been a response. You're going to get the release of hydrochloric acid. You're going to convert pepsinogen to pepsin, and you're going to start to get the breakdown of proteins in that food through enzymatic and through pH change. And I do think that pH, sometimes in certain circumstances, pH change is protective, actually, against toxins. And I'm not sure yet. It's very early days for my research with this, but it seems the body has lots of mechanisms to either eliminate, bioremediate, change the structure of whatever it is so it doesn't harm us. So it's got lots of lines of defense, right? So once it gets through one of the early lines of defense, it goes, we can't easily eliminate it now. We could vomit, which is one of the things it can do, Or we could start to produce more acid, lower the pH, and this could denature it in some way
Hmm.
and allow it to be less negative on our body. It depends what it is, of course. And I don't think the body can always determine what it is necessarily and have exactly the right response. But that might be another reason to get reflux. It might actually be a way of flushing out the esophagus of toxins. It's hard to say because I don't think that it's always, I don't think every so called bad response is inappropriate. I think it can be inappropriate and appropriate. And this is all relative to if they have a vagus nerve problem. If their vagus nerve is working well, you can still get reflux. And it may be because of the fact that the body is trying to eliminate something in the esophagus that's trapped there. Could be. Okay, so once it's been through that stomach, it's going to go through, contract. The stomach contracts and it pushes everything through to the duodenum. You can get pyloric. The next sphincter is the sphincter after the stomach, called the pyloric sphincter, and that has to have the same effect. So it has to close properly, but many people's do not, and so it allows the acid to leak through and changes the pH in the duodenum. That's a problem because you can't really absorb food properly at the wrong pH. So the body produces bicarbonate that's released there. That's a vagally mediated process. CCK, cholecystokinin, and a bunch of other different hormones and different enzymatic releases as well from the pancreas and the duodenum itself. Bile gets released. But the bicarbonate is to change the pH. So the food is able to be broken down more adequately. Enzymes allegedly perform better in that environment. So we change it back to a different pH once it's been through the acid, goes through the acid breakdown, and then, okay, now let's protect the duodenum from acidity because it's not really accustomed to doing that, but it might, deal with some problems of acidity if the vagus nerve is not adequately functioning. And then we get our motility. So all that function of moving it through the digestive tract after that is vagally initiated. There's conjecture over whether it is completing the entire task, but for me, it is a vagal process. Any other nerve that's involved is mostly just like downstream nerves that are being commanded by the vagus nerve. So I wouldn't, there's different ways that neurology and neuroscience divide things. The pancreas behavior is all vagally mediated. The spleen, in some ways, is too, although that's very controversial. The liver is 100% innervated by the vagus nerve, and it's likely that every detoxification process has a neurological component. If you don't have the nervous system involved, organs are inert. They don't really do anything without the nervous system's involvement. Everyone says, "Oh, you've got the gut brain. It's its own thing." It's not really true. You could just cut the vagus nerve and the sympathetic nervous system to the gut, and you just get this like crazy mess of activity. It's not really in any way productive. So it's kind of like cutting the cord, and then all of a sudden you get really confused. But you can't. Your brain is actually active, but you're unable to use it, and that's pretty much what the gut brain is. It's a coordinated system of nerves, but they are coordinated by the vagus nerve and sympathetic nervous system.
Hmm.
Um, there are other
Okay.
innovations, but they're the predominance of innovations. The big thing that I think where it gets really interesting is detoxification, and because nearly every single interface of toxins in the body, nearly every single one, are vagal irritant receptor sites. The vagus nerve is then involved in the mucus production in nearly every single instance, including the gut. The vagus nerve is involved in the vomiting reflex. It is the vomiting reflex, it's the cough reflex, and it's the diarrhea response. So you can see how I would presume the vagus nerve is involved in detoxification. It's pretty important, right?
Absolutely.
And there is the whole brain detox component, but we can get to that later. But that's really what the vagus nerve is. It's our survival nerve.
Wow. It was fantastic. So dysautonomia is just, maybe you could explain that a little bit.
Yeah.
What I'm gonna assume is that it's just, poor vagal functioning, right? You don't have things responding when they should. That's the
So
main driver is what I'm kind of
yeah,
gathering here. But
oh, without a
please,
doubt.
um, yeah,
So
please, like I'd like you to maybe talk a little bit
dysfunctional
about that.
autonomic nervous system. I think this is a new area relatively. So there's not really specialists in it. They're purported to be specialists, and they've categorized so-called conditions, syndromes. So these are the classic syndromes or conditions you'll hear under the term dysautonomia. One's
Hmm.
called postural orthostatic tachycardia syndrome, POTS. And what's interesting is that although I know that it's a vagal problem, and I'll explain why, it's not very well discussed. It's not even really, if you look at the dysautonomia papers on POTS, they never really discuss the vagus nerve. It's insane. It's like completely ignoring the fact that the vagus nerve could have a neuropathy, which we'll talk about, leading to said problem. Now, I don't think POTS is beneficial at all. It's quite debilitating. What POTS really is someone, when they're upright versus lying down, well, they test it when you're lying down, you go upright quickly. If someone gets dizzy from that or is constantly in a dizzy state or lightheaded or that kind of anti-gravity kind of symptoms, the reason that they have that is that when they sit up, their blood pressure is normal and their heart rate goes up and their blood pressure might go up a little bit, which is all normal. And that's because we're trying to get blood to the brain against gravity. But then what happens is that heart rate skyrockets and it doesn't get controlled and it doesn't get suppressed. And the reason it doesn't is because the vagus nerve is not suppressing it, right? So the vagus nerve comes in when things go awry, when your blood pressure is all of a sudden too high, it suppresses it and adequately dilates blood vessels, reduces heart contractility, sometimes reduces heart rate to lower your blood pressure. But when it comes to POTS, your heart rate is skyrocketing. So what it does is it says, no, this is too high. Let's bring it down a bit. And it brings it back to normal so you can go about your daily life. It's very different to hypotension, postural hypotension, when you sit up and your blood pressure drops. That's actually excessive vagal activity, right? We'll get to
Hmm.
that. That's somewhat considered dysautonomia. But POTS really is not ever talked about like the vagus nerve. They'll mention things like, oh, you've got autoimmunity or something. You've got all these ambiguous, unprovable things like, oh, you just haven't got enough water in the system. And that's true. You can have people who have a lack of system-wide water, so they're just dehydrated, and it's what causes it. But it's an aggravating factor. I don't think it's causative. So basically, the vagus nerve is not working. They stand up, their heart rate goes up above 30 beats per minute. So you might start it at 65 and it's gone to 95 or above. Now they're a positive case for POTS. What should have happened is they got up and that heart rate raised up and then it came down. It didn't get that far. That's appropriate. That's what we all should be having. But these people don't. That's one type. The other one is gastroparesis. So that's stomach weakness, you could say. But really what it is that as the food moves through the stomach, it doesn't adequately get it into the duodenum in an appropriate speed. So they do this thing called a gastric emptying test to see the speed at which things move through. And they'll see that it doesn't, or it doesn't do it in an adequate time. And so then they'll give people prokinetics, things that stimulate through drugs. And that's a famously vagal, because you can imagine, I've already mentioned that the vagus nerve stimulates the activity of that gastric, of the stomach motility. And so without the vagus nerve, you don't get stomach motility. So, I mean, it's no wonder what causes that. And it can happen due to surgery, so they'll cut the nerve. Gastric sleeve surgery is the biggest one. Then you get any number of cervical surgeries where the vagus nerve is running through here. You cut the nerve there and you get gastroparesis. You can get vagus nerve damage from lots of different things, which we'll talk about. Gastroparesis is another one that's termed. And I would just call that, you could term it that, but it's not really a condition. It's a syndrome. And then another one you'll hear is this sort of thing called autonomic neuropathy. And it's essentially autonomic nerves have some level of neuropathy. leading to symptoms of dysautonomia, like excessive sweating, like elevated sympathetic activity, And look, to me, it's classic medicine. They're just trying to refine things down to one thing, and it's not even very accurate. All of these can be explained by either low or excessive vagal tone. And so vagal tone, let's explain that. So vagal tone in context to a nerve is the amount of electrical activity per unit time relative to what it needs in that moment, right? So let's just say your vagus nerve is meant to activate, and there's a relative number of electrical impulses per unit time that is required to achieve the goal. So good tone means that's high. Low tone means that's a bit slow. Instead of being electrical activity going out, it's yeah, as an example. That's low tone. Excessive
Sure.
tone is like through the roof electrical activity. Now, low and excessive are both bad, and they can both be caused by the identical thing.
Wow.
So there are people who actually do have both. You'll see this on one of the measurements we use in clinical practice called heart rate variability. Everyone's probably heard of this. It's the gold standard of autonomic nervous system function. And essentially just tells you how flexible your autonomic nervous system is. How much flexibility do you have to go into sympathetic, fight or flight, and back into parasympathetic. And it's a good measurement for cardiac vagal tone. Not necessarily gastrointestinal vagal tone, but cardiac. So these people will be like, one day they're at 30, 25 HRV. The next day they're 180. Like, it's crazy. And all this is to do with vagus nerve compression. So, as far as this term dysautonomia, it really just means low vagal tone or high excessive vagal tone or seesawing.
Okay.
And that's how I look at it.
Sure. Awesome.
Maybe I should explain some of the other symptoms of low vagal tone.
Yeah, sure. Yeah,
Yeah,
definitely. If you
sorry.
want
I
to
know
add
that just a lot of
add to
content.
that.
So I'll
No,
explain that
no,
because
it's
people then
great.
be like, well, what is low vagal tone?
Yeah,
So low
yeah,
vagal
please,
tone
please.
picture in the heart looks like tachycardia, high blood pressure. In the gut, it's poor motility, bloating, malabsorption of food, like fat malabsorption, carbohydrate malabsorption, all these different macronutrients, deficiency syndromes. Uh, then you have a little more kind of anything to do with the brain. The vagus nerve actually innervates a lot of brain structures. It's involved in the release of serotonin, dopamine, and noradrenaline or norepinephrine. And it's very interesting with that. So people who have low vagal tone tend to have brain fog, not because they have brain inflammation necessarily, but because they have low frontal lobe consciousness, monoamine systems are not as active in those areas. So monoamine meaning dopamine, serotonin, noradrenaline. And those are what are called neuromodulators. So when you have low vagal tone, you just can't focus and you can get it with excessive, but it's because everything is it's disturbed in some way. But most people have low vagal tone, and that low vagal tone, those nuclei I mentioned earlier in the medulla of the vagus nerve, they have connections all the way up to all these different other nuclei that send out neurons to the frontal lobe and other areas of the brain, of course. But one key one is dopamine. So our ventral tegmental area, VTA, this is our dopamine producing nerve cells. They come out of our brain stem and around our diencephalon and go through to the frontal lobe, and they release dopamine there and make it wired to activate. Essentially, it's like putting the plug in the wall, right? You need to plug it in. It's not on necessarily. We haven't turned it on yet, but it's plugged in. So these are plug-in chemicals. They don't turn the brain on per se. That's glutamate. Yeah, some of you might have heard of glutamate. So we need our brain to function well. We need good activation. We need to be wired to activate in our frontal lobe to be able to complete our daily tasks, to be able to do things, calculations, things like that, computation. But if we don't have good dopamine levels in our frontal lobe, we just can't do that. It's the same for noradrenaline and serotonin. And we don't fully grasp how they all work in conjunction with each other. There's lots of theories. But the vagus nerve is critical to that. And it's found that in animal models, when you stimulate the vagus nerve, you get a huge increase in tonic outflow, meaning electrical activity, in the dopamine nerves, in the serotonin nerves, and in the noradrenaline nerves to the frontal lobe. Pretty cool. Basically, that's all about improving your executive function. It's what everyone's trying to do breathing techniques for, eating well for, but you can actually just do vagus nerve stimulation. It doesn't have to be electrical, and you actually can improve it too. Coming
Wow.
back, low vagal tone is just generally often seen as systemic inflammation. The vagus nerve has a big role to play with detoxification. So when it's not detoxing, the inflammatory markers appear to rise. And when it is activated, they seem to drop. So everyone in the literature says, oh, the vagus nerve suppresses inflammation, just like a corticosteroid. Of course, it doesn't do that. That's absolute junk science. It's just presumption based on the current bias that they have for how things work.
Yeah.
But excessive vagal tone, let's briefly mention that. So that's generally seen as a relatively low blood pressure, low heart rate. They tend to be have really fast gut motility, so they go to the toilet lots throughout the day, diarrhea. They might have constant or intermittent nausea. Nausea is the most common problem that they will say because it affects them more than anything else. They might also vomit all the time. In the early days of clinical practice, I didn't really understand the symptom. I thought, well, I didn't understand it at all. Why were these people constantly vomiting, constantly getting nausea? I thought they must be really toxic. Their body's trying to eliminate all the time. But it turns out, through my own experiments and my own clinical experience, is that if I find the area of the vagus nerve that is being compressed and I treat that, and I also can do these things called vagus nerve suppression techniques, where you basically just compress the vagus nerve, flat compress it, and just stop it from releasing, doing anything lower down, you can completely turn off that feeling. It is absolutely phenomenal. Like, you can hold the vagus nerve flat, compressed, nausea gone. And that's enough evidence for me. Like, the fact that it's so obviously excessive vagal activity. If you compress a nerve,
Wow.
normally if you compress a nerve, you get pins and needles numbness. If you rest your arm on something, eventually your hand goes numb. That's the same thing, right? But in other
Sure.
nerves of the hand and arm.
Yeah.
But when it comes to the vagus nerve, you don't really have that perception because it goes to the organs. You don't feel them per se. So how would you know? You would know because your heart rate increases. Because when you hold your vagus nerves and compress them, you'll actually feel like your lungs are dilating. It's true. It's actually a great way to stop asthma attacks. And there's all these weird things. So I'm still coming to terms with the best way to approach some of these cases because if we can't find the zone of damage or compression, then there's no way we're going to fix it. So they're the main two. There's excessive vagal tone and low vagal tone.
Interesting. Okay, I think good time to get into maybe what the causes are. Like, I, and
Yeah,
I,
for sure.
I would trust that we're looking at real root causes here. You know, and a couple things that just came to mind is poor breathing patterns. And um, excitotoxins. You said glutamate turns the brain on. MSG is a huge additive.
Yeah, definitely.
Um,
Yeah.
those are just things that popped in my mind. I feel like EMFs got to have something to do with it, non-native
Oh,
EMFs.
without a doubt.
Um,
Okay, so yeah,
yeah,
yeah, yeah,
but
yeah.
I
Okay,
want you
yeah,
to expand on
yeah.
that. Those are just things that popped into my mind there.
So this is a burgeoning field. We don't have all the evidence yet, but there is some
Yeah,
clear things, right? Now, likely the list of things that cause damage to the vagus nerve is so long that there's never enough time to mention them all. But let's talk about
sure.
the definitive ones, like without a doubt. Okay. So, firstly, before we get to damage of the vagus nerve, we've got to talk about compression. Now, compression is analogous to something like you've probably heard of carpal tunnel syndrome, right? That's the median nerve and it gets trapped here. There's other types of syndromes of nerves in the periphery. And those I treat them too. That's my area. I treat nerves. That's my main professional work, is all nerve problems, which is pretty much everything, to be honest. That's another topic. But compression of nerves is not is well established in the literature. What is not is vagus nerve neuropathy, or no, vagus nerve compression. And it has only a few areas of which this can occur. So it could theoretically occur in the brainstem. They're pretty sick people, and they're normally to do with tumours. It can occur as it exits the skull through the jugular foramina, normally tumours. It's not common. It can happen. It can certainly be damaged in these locations. Let's not talk about damage. We're just talking about compression. And as it comes down, it goes through this very vulnerable area called the carotid sheath. This is where it shares a pathway, or like a little kind of tunnel with the artery and the vein. And as it comes down, it has lots of areas where it can be compressed. One is through local structures that are enlarged, like a goiter. It's not about whether goiters are appropriate or not, but just goiters can push on the vagus nerve. I've seen it clinically. They remove the goiter, or they make the goiter become smaller, and the symptoms alleviate. You can get tumours in the neck. It's not uncommon in as far as tumours are concerned. Of course, they are uncommon generally. Bony prominences. So a lot of people have degenerative cervical spines, and they have these little, they're called exostosis or spurs, and they put pressure forward onto the vagus nerve here. Some people have alluded that it's to do with alignment, but that evidence is pretty lacking. There's a better explanation for so-called alignment problems causing vagus nerve pressure, and that's instability. Now, this term instability comes up a lot in vagus nerve niche world, and there's lots of solutions, apparently. So instability is the perception that firstly, there's a perception of what instability is, and that's where your neck is weak, often tight, and unable to hold your head up, and it fatigues and it's tiring. You can't really lift your head appropriately when you're lying down. So you go to lie down, you go to lift your head, and you have to hold it to lift it. It's just straining all the time. Those are very quite common causes. That is quite a common cause. And one of the things that happens there with those people is that you'll see that the vagus nerve is running between a lot of muscles in their neck. So there's muscles at the front, side, and the back of the vagus nerve. And when they're moving around upright, particularly upright, this goes back to POTS, their vagus nerves get compressed because those muscles in their necks are at full contraction. Because muscles that are really, really weak tend to have to contract harder to do the same jobs. And often that causes a problem. So it's guarding due to weakness, due to maybe some instability in the area. But this is not a complete picture. It's very strange, some of these cases, because they shouldn't have instability, but they do. And and one way of looking at it is that they've got more than one nerve affected. They've actually got multiple nerves that have been damaged in some way. And they don't adequately innervate the muscles of the neck. And in their arms and their hands, they just ignore it. But when their neck's a problem, it really is obvious. So one of my theories is that they've got neuropathies everywhere. They're low grade, and it leads to weakness in the neck and guarding of that vagus nerve. So that's a bit of a long-winded way of explaining it. Some people recommend you use a thing called prolotherapy. That's an injection of dextrose into the joints to stimulate collagen production and stabilization. I think that's fine. I don't see any negatives per se with using it because it's just dextrose. But with a lot of these injections, there's never just one thing in there. Who knows what else is in this injection? I use a thing called shockwave therapy. Uses pressure. And one of my beliefs is, yes, that nerves are crystalline structures that are made up of structured water. And I see that neuropathy really is a destructuring of water. That's why the information can't get through. And the shockwave creates a pressure wave and a vortex and microbubble formation, which is exactly what happens when you try to structure water. So the shockwave, which was originally designed to break kidney stones, it's been repurposed. It used to be called lithotripsy. And now you can apply it to nerves and you can restructure their water, in my view. which is a great way to improve nerve function. And I see results immediately. That's why, we're still trying to get our heads around the idea of destructured water, structured water within nerve cells, how that actually creates electrical current, allows for it. So that's in my view on the side here. But as far as the mainstream perspective, what the way I would talk about it is different. I would say that shockwave decompresses the nerve by shaking it loose from adhesions and built up pressure and creating a localized area of pressure which expands it and decompresses it. And you could look at it that way too. Sorry to go on a wild tangent here, but this is a bit of an area of interest for me of how to deal with these problems. So
Sure.
this is a common area of compression. There's a few other ways that we deal with it, but that's the most common way I find and most effective. You can get it, compression of the vagus nerve as it goes into the area of the heart and the lungs and the gut, but that's normally from tumors. The other one, which is really common, is hiatal hernia. So your diaphragm has this little area in it like that allows for the esophagus to go through and the vagus nerves. And a hiatal hernia is where the stomach itself has moved up because the back gap is too big. It's herniating, right? And it's heavily linked to things like hypermobility syndromes and certain drugs. Don't know how the drugs cause it, but it's linked. And it goes up and it gets squashed because it hits basically loggerheads, gets locked in there. And the vagus nerve kind of gets trapped like that. And people do actually it's true. It's well
It's a good
established now.
example.
And yeah, I mean, that is a really common cause, very hard to diagnose because it doesn't happen all the time, like you're breathing. So it comes in and out. So it's kind of, and one of the most common symptoms is reflux for hiatal hernias. So they get heartburn. Makes sense, right? Because the
Yeah.
stomach's going up and it's putting pressure upwards and then the sphincter opens. But it could also be because of the vagus nerve. So what I do with people with that in that regard, because I don't necessarily recommend hiatal hernia surgery, because that can even damage the vagus nerve. I've got patients who've had hiatal hernia
Sure.
surgery to fix the vagus nerve problems, end up damaging it further and getting worse. So first, do no harm principles, but I get them to do really, really intense diaphragmatic breathing to strengthen that diaphragm so that hole closes by the contraction of the diaphragm. So the diaphragm has more tone in it, therefore that hole should theoretically be smaller. And it does work. It does work. But a lot of these people I see, they don't just have vagus nerve neuropathy. They have phrenic nerve, which goes to the diaphragm neuropathy. They have radial, median, ulnar, everything. And they often get diagnosed in extreme cases with Guillain-Barré. But I don't believe in that term, but it's garbage.
Sure.
It's better to say that something they've had or been exposed to has created a neurotoxic effect, widespread. Has to be something they've either breathed in or swallowed. In some way got into the blood. And it's affected nerves widespread. Yeah. And, with vaccines are one cause. So let's get into the damaged ones, right? Sorry, I'm talking so much.
Yeah.
It's a big topic.
No,
So the
no, it's good.
damaged ones, let's talk about them. So damage to the vagus nerve can be through something chemical. So VOCs, huge category, one of the main causes. Fluoride,
Sure.
very much so. And you know how it affects IQ? Well, the vagus nerve, the lower your vagal tone, the lower your IQ.
Interesting.
And that's not the only thing because it's also affecting brain structures. So it's cognitive as well.
Sure.
Anything that's termed neurotoxin is a potential source. It's likely benzene, dioxins as well. Anything like sunscreen use, particularly in and around the neck,
Yeah.
affecting the vagus nerve. Anywhere really, it gets into the blood, so you can get to anywhere. Another cause is drugs. So the most common one is chemotherapy, obviously. So a lot of people will get all these symptoms after chemo, and they're some of the
Sure.
hardest people to treat. It's trying to find where those damage centers are, where the damage has occurred. And you can actually get repair of nerves. They do repair, and you do things that stimulate repair. So I use a combination of shockwave because it activates repair enzymes, and light therapies, red, near infrared, infrared. You can use other colors too. There's not much else out there. You can do all sorts of things to improve blood flow to the area, needling, things like that. You got to get those nerves functioning back again, getting their myelin repaired and everything, and the internal structures repaired, and the structuring of the water again. It is feasible. Okay. Another reason is alcohol use. So alcohol is very much damages nerves, demyelinates. Alcoholism in itself is a neuropathy causing toxin. So alcohol can severely suppress your vagus nerve, leading to high blood pressure or any other thing you want to say that I've already mentioned. Yeah. So that's really common. Smoking can, but not because of the nicotine. Actually, nicotine is a vagal stimulant, but everything else in cigarettes is terrible for you. So any heavy metals that you consume can, because most metals are neurotoxins. So metal ingestion, inhalation can lead to vagus nerve damage. Because remember, the gut lining and the lung lining are all vagus nerve linings. So
Yeah,
anything
yeah,
where the
exactly.
vagus nerve is, this is why the vagus nerve is more commonly injured,
Interesting.
because it's the interface. The other one that's commonly injured is the trigeminal nerve, which is the nerve of the head and the face that supplies the skin and the head and the jaw muscles. And so people often have problems there. They're often seen as headaches. Trigeminal nerve is the main nerve involved in headaches, and it's the lining of the sinuses, the mouth, and the upper back part of the throat. So it often gets toxic exposure, and then you get neuralgias from that. Yeah. But of course, they don't blame it
Interesting.
on that. They blame it on other things.
Yeah.
So there's lots of ways that the vagus nerve can be affected. The one other thing that I will mention, it's a very interesting, is it's in utero damage. So
Oh,
babies, we know that if you're a preterm baby, your heart rate variability is much lower than a term baby. And that's generally been explained that you just haven't had enough time to develop your nervous system. But by then, your nervous system is very well developed. It's mostly your lungs that aren't. And what's the deal? Well, I actually think there's vagus nerve damage in these children. And you see why. Because if you look up causes of preterm, premature babies, you'll see that it's toxin exposure. They've even say environmental pollutants are an actual common causative factor of preterm birth.
wow.
And
Interesting.
that is one of the potential causes of vagus nerve damage. Then things like alcohol consumption, obviously, smoking, drug use, but also abusive partners. So relationships that are abusive during the birth, during pregnancy, can lead to
Yeah.
preterm births.
Wow.
And I think that's because of the stress factor as well. But I think that's that huge stressor on the mother can not necessarily damage the vagus nerve, but it can tune it towards being of low status, and that the stress
Yeah.
system is more important. Because when we come out of this womb,
Yeah.
we're going to have to deal with a
Wow.
lot of stress. So we want to be really good at that.
Wow.
And so I think
Wow.
there's not all of the stimuli or the things that so-called cause preterm damage the nerve. They tune the nervous system to being better at one thing. Yeah, there's some people who have the opposite effect. They actually have this so-called like low sympathetic response. So they go all limp in stressful situations rather than like, fighty,
Yeah.
That's the, low vagal response to stress is, I'm going to fight you no matter what. Like it's always, and they just get sweaty and they get really agitated and run away or fight or, just get aggro much more than they should. And that does come in with the fact that their brain is not able to say that's inappropriate. When we're dealing with stress, we have cognition. We have the ability to go, what's appropriate right now in this situation? How do I deal with this stressful situation to get out of it? And our brain is very active. It doesn't just shut down. Some people are purporting to say that the vagus nerve is the be all and end all of the response of stress. It is not how that works, in my opinion. We'll come to that. But we need our frontal lobe active. The vagus nerve is involved in that. We need the vagus nerve active during a stress response. If we don't have it active, you will exaggerate your stress response. If you have too much vagal activity, you won't be able to mount a stress response. You will go all limp. You'll lose tone. You'll have what's essentially like a vasovagal response. I think you've lost my video.
Yeah, your video seemed to freeze there. Maybe just restart the camera.
Yep, I'll just restart it. Man. You can't edit this out, can you?
All right, some camera issues there, but we're back. You were saying low vagal tone.
Well, so low vagal tone is this hyper-responsive stress response. So you just get
Sure.
too much of a stress response and you don't tone it down adequately. And that's partly because our vagus nerve is not adequately connecting with our frontal lobe. That's my opinion. So our frontal lobe can't make cognitive decisions about the situation. So you can't keep cool in stressful times. You can't make correct decisions. So you make exaggerated or inappropriate decisions in times of stress. And this can be expressed as chronic stress. And you'll often find that these patients that I have, they have chronic stress, aren't even that, like their environment isn't even that stressful. Okay. There are some who have chronic stress and it's appropriate. Their child just died. Their husband just left them. There's all sorts, their mother died. There's things that are obvious that
Sure.
are stressful, but, work's really stressful and it's actually not. It's just that they're not able to deal with the stressful situations. They experience stress much more readily because they're unable to have good cognitive activation during stress. Then it
Wow.
comes to a thing called excessive vagal tone, leading to an inappropriate or not enough of a stress response. And this is seen as low sympathetic or high vagal activity during stress. And it could be really, really extreme responses, such as vasovagal responses, where they just faint. And that's the vagus nerve trying to control the situation, but it goes too far. And it leads you down, just like it would with postural hypotension. And because that response is too excessive, it's too much in that situation, you actually get no sympathetic response. So you get a drop in your heart rate, you get a drop in your blood pressure, and you just go limp or you freeze.
Hmm.
And there are a group of people who believe in this thing called the polyvagal theory. You might have heard of it.
Yeah.
I have real problems with it because its basis is on the idea that we have this kind of hierarchical order of vagal systems, ventral vagal, dorsal vagal, and in some ways how they're kind of divided phylogenetically because of our evolution. In some point we developed different parts of the vagal system, how parts are myelinated, non-myelinated. Most of this is not based on any credible evidence. The truth is it's completely integrated. There's no division. These nucleus ambiguous, so-called ventral and dorsal vagal, these are not isolated systems. They are interconnected, wired. They are going, like fibers from each are going to the same structures. That does not sound very phylogenetically divided to me. So I think that the truth is that the principles of, when I read the papers on polyvagal, I realize that what it really is, and this is in a counterance because I like LeDoux. I think it's LaDoux. His idea about how the brain works with emotion. It's more about cognition. It's more about the amygdala, neural circuits. It makes much more sense to me because I work in the neuroscience field, whereas Porges is in psychiatry and psychology. So they talk about neurological structures in a way to back them up, but truthfully, they're not accurate descriptions So they don't back them up. They disprove the foundational understanding of what they're saying. And then they extrapolate by building on that flawed foundation. So everything is based on that flawed foundation. I mean, there is so many critical reasoning errors in the polyvagal theory that for me, I just can't accept. I can't accept it. And I recommend people read about it. It sounds good, but not everything that sounds good is real. And truthfully, one of the key problems in it, and you'll read this, it will say that there is some level of ability for the vagus nerve to determine, or at least the autonomic nervous system, to determine the severity of the threat. Right? So if it's too severe, we will have this response. If it's medium threat, then we'll have this response. That's cognition. That is the ability to determine things based on previous experience. That is not innately in us. You know, a baby doesn't really have great threat detection. Has some threat detection, but truthfully, we're trying to keep them at away from harm, right? Because they don't
Yeah.
have the threat detection. It is a
Sure.
learnt thing. It is
Sure.
stored in our brain. We have a great threat detector called the amygdala. It is our alarm system, right? Part of our limbic system. And it does have heavy connections throughout the body, including the autonomic nervous system. And our autonomic
Hmm.
nervous system has the ability to communicate with it to make suggestions and like suggestions, kind of input about what's happening in time. But at the end of the day, what is stated in this theory is that there's some kind of autonomic brainstem based non-conscious, which there's no such thing as non-conscious processing, really cognitive. There's no cognition in the brainstem. So how are we supposed to believe it when the basis of it is completely flawed? Now, I'll get a lot of hate for that. You know, people love this theory, and I just can't buy it. It's there's too many things, there's too many flaws, and it's too many holes in it. But I do recommend. I think it's LeDoux. I'll just get the name of the author. I recommend this paper. Let me get the name of it. What
Please.
emotions might be like in other animals? It's called. Sounds funny. Joseph LeDoux, LeDoux. It's a great paper, and highly recommend it because I think that it explains things at a much more appropriate level. Now, you can add in the vagus nerve and say that the vagus nerve influences emotions because it does. But I would say that it's the workhorse of the control of the stress response rather than it being
Interesting.
like determining the stress response from a
Hmm.
cognitive level. It's look, people in neuroscience will understand what I'm saying. Like the cognition is not something that happens in lower order structures.
Sure.
Human beings have, all mammals have, and other animals as well, have cognition to a certain extent. Humans have the greatest, this ability to almost like uh, understand things at a very, very abstract level. Words of abstractions of words, abstractions of meanings, things like that. Very complicated concepts that others we can't appreciate them that they can. Obviously, they possibly could. We just can't measure it in them. But that just means that the vagus nerve is not the determining factor.
Hmm.
Yeah.
Amazing. I appreciate you sharing that. And I guess on the topic of disagreeing with maybe the majority, um, the classical understanding of the nerve, I already know your answer because you did mention it earlier. The ion transport,
Mm.
model and um, kind of the classical explanation for how information energy travels through nerves. What are your thoughts on that? You mentioned structured water and how the nerve is a structured
Yeah.
water, and maybe if you could just explain kind of what your perspective is on that, and don't worry about time.
Mm,
We're doing great here. So
okay. So the kind of classical idea of how a nerve works is a nerve is like a tube or like a wire, not a wire, but a tube that's filled
yeah,
with water, and that water has electrolytes in it. And electrolytes allow for the transfer of energy because, well, they are electrolytes. Okay, so they have a current flow, gradient, the ability for it to maintain this so-called resting membrane potential is that it's able to be in a state where inside that nerve cell, that tunnel, that tube, there is a certain voltage. Yeah. Um, it normally sits around minus 70 millivolts or minus 80. It depends on the nerve. And when a stimulus comes in, we get so-called neurotransmitter, right, release from one nerve to another through what's called the synapse, which I don't hold it dear at all. It is the fundamental structure of neuroscience. But anyway, the synapse, let's just say it happens, that neurotransmitter, a good example is glutamate, then gets released onto a receptor. And that receptor is normally what's called an ionotropic receptor, which is a pore receptor, which there's a little receptor cell on the outside. And as soon as it binds to that neurotransmitter, it opens and allows in sodium, for example. Okay. So it does then change the voltage of the inside to be more positive, and at some point it gets to minus 50 millivolts. I think it's 55 from memory. Bang, that initiates this cascade of opening of voltage-gated ion channels all the way to the other end. And somehow, if there's myelin, it just skips those parts that are myelinated. This is a complicated picture. My main area I used to be a lecturer in neuroscience for 9 years. And so teaching this and talking about it now is kind of like talking fiction. It's a good story. The truth of it is when you watch this concept about the way that current flows and these channels opening all the way, you go, it's pretty inefficient, eh? And these so-called unmyelinated nerves called C fibers, they're one of the types of pain nociceptive neurons. They actually allegedly propagate information without the myelin. So they have to constantly be opening those channels to keep increasing the sodium levels inside the cell. And it's just mind-boggling that is the system of which we are getting current flow when all we really need is electric current and conductive surface. We don't need to go chemical, electrical all the time, because that's the system at the moment. The system is you release a chemical, you get an electrical response. It's like transference of energy. It's like change of energy from chemical potential energy into kinetic electrical energy, and all the way it goes, and then it becomes chemical again. It's pretty inefficient, right? So I'm not convinced by the idea, and the resting membrane potential is critical to this because without an appropriate resting membrane potential, we can't produce a current. So yeah, and that the idea of the transportation of ions in and out to maintain that using ATPase transporters, things like that, that is definitely rubbish. There's no doubt in my mind. There's not enough ATP. And the rate of it, like, it's so inefficient. It's like it's burning wood or not burning rubber for heat. It's just, I just don't appreciate I've always read it and gone, well, that's what we think at the moment. This is what I'm going to teach.
Sure.
And when you're an academic, you can't really go off script. You can say a bunch of things that you feel that may not be quite right, but this is what you have to learn, kids.
Yeah.
And these transporters, these sort of maintainers of the resting membrane potential, I think they're completely theoretical. I think that's all that it's purely hypothetical, not theoretical. There's no good evidence for it because the maths don't add up. Yeah, I agree. But I think that the system could be crystalline structured water and allows for the flow of current. But there is more to this than that, because it seems that nerves also have a language. There's these studies that are done in the brain of, I think it's animals, not humans. You'd hope so. And they can read the frequency of a neural activity. So as a nerve cell is releasing, well, the electrical activity is quite high, and then the frequency changes and the behavior of the second nerve changes. And it's not necessarily what you think. This one might go from being slow to fast, but then another speed. There's a third speed. Because mostly two speeds would represent maybe on or off, but there's a third or a fourth. And
Wow.
this is very strange. I don't know where that paper is. I read it in a neural circuitry textbook that is this thick. So it's known out there that the nerves do have sort of a language that they are talking. And that would make sense because things aren't linear in the brain, they're just a mess. There's just so many activities going on. There's no way we would understand that. But I think that the best way is to say that our brain can communicate to structures in almost in a non-binary way. Like, so not yes or no. It's more than that. But I'm not sure how. And I think that's one thing to add to the whole concept of re-understanding nerves, reimagining how nerves work.
Yeah. Awesome. All right. The last topic of the day, I want to bring it back to detox.
Yeah.
Yeah. And we're doing great for time. Don't worry at
Yeah,
all.
yeah,
I
no,
want you to
that's
give it
good.
your all. Here. Yeah.
Look, so I'll revisit. So there are I'll reference. I've got my little note here. It's just to make sure I don't forget something. Um, the first thing with anything with elimination, in my view, um, is that one we have to understand that in my view, low vagal tone causes impaired elimination detection problems and detoxification. Okay, so the main thing that we need to have in our bodies to be healthy is good detection systems. And that happens in our sinus, our mouth, our back of our throat, our esophagus, our trachea, our lungs, and our gut. Our skins too, skin as well. I didn't mention that much, but that is another area of interest. Vagus nerve stimulation is being shown to improve psoriasis. So there's something going on with the skin interface, but disregard that for now. Once we've got detection, we then need isolation or capture, mucus production, whatever it might be. There might be other mechanisms that we're not aware of. Then we need to, in some situations, bioremediate it. We need to change it to eliminate it. We may not be able to eliminate it in its structure because it, for whatever reason, it may not be water soluble or it may not be able to be vomited in the adequate way, right? So it'll just sort of do its own thing if we produce a vomiting reflex. So we might need to bioremediate it. And the body can do that possibly through a few different ways. I've mentioned already that it can eliminate through the vagus nerve through vomiting, diarrhea, through coughing, mucus production, coughing, things like that. But then it can bioremediate. There's no doubt about that. So there are studies done with, and I'd highly recommend you look at this. This is my area of main interest right now, is bioremediation transformation in
Awesome.
soil studies. So you look at the bacteria that need to be in the soil for there to be no cadmium in the plant. Listeria, for example. Listeria is needed to be present. As one example, Listeria is a highly potent bioremediator of cadmium. And if you look up the symptoms of cadmium exposure, they're the same as Listeria. Aha, what a surprise. There we go. This is actually what raw milk, it's because it's laced with cadmium. This is why it's a problem. And this doesn't mean we shouldn't heat it up because maybe heating it does bioremediate it. So it's not like things are being done that's incorrect. It's just being done for the wrong
Interesting.
reasons. And it
Very
might be
interesting
the
point.
case that one day we'll give people probiotics with listeria in it. It sounds really
That'll be the
crazy,
day.
but it's not crazy at
Yeah.
all. So I think that the bacteria, the parasites, the fungi, these all bioremediate different things in different ways. I think we can
Yeah.
say that for sure with heavy metals and
Okay.
parasites, with
Definitely.
like dientamoeba and blastocystis, that probably just workhorses of detoxification, hence why they're there. And fungi like, for example, different yeasts. That's probably why Saccharomyces boulardii can be very effective for some people as an actual supplement. Um, but also, candida gets worse in some people. It's probably just a way of bioremediating an entire gastrointestinal system or other orifice, so like genitourinary. Um, uh, whatever temperature. So the body can increase temperature. I think that's bioremediation. I think that if you
Yeah.
increase the temperature of the system, you may be able to change the structure of the toxin. It's possible. That's one reason, but also sweating. And we now know that constituents of sweat are toxins. So that's not pseudoscience anymore. Papers coming out every year about this. So sweat is definitively a detox process. Okay, well, that's cool. And the vagus nerve is actually linked to our thermoregulatory center in our hypothalamus. So I don't know how much it's involved in that, but it has to communicate that there's a toxin. So where's it going to tell? It's going to tell another part of our elimination system, so we get a fever. But a lot of people get a fever and they don't actually sweat. I think that's unhealthy. I think you need to sweat it out. I think you really need to get it out of the system. Um, and you hear about these so-called febrile seizures in children from temperature being too high. There's got to be some kind of evolutionary benefit to a febrile seizure in a child. I don't necessarily think you should promote it. I'm not saying be careful what you say these days, but I'm investigating what all these so-called bad things are and whether they actually have an unknown benefit. Enzymes could probably do it too. There's certain enzymes that the body could produce that break down structures and toxins that would, just another bioremediation effect. About pleomorphism. So obviously, it could even happen with parasites for all we know. Like parasites might just form through that as well. The body, some believe that the body makes the parasites. They're not actually coming in, which
Yeah.
I'm open to. It makes sense because I don't really know where they're getting these parasites from half the time. And all these different types of bacteria. I recommend you look up soil studies, bacteria, bioremediation, and you'll blow your mind. Like even on the first page of what salmonella bioremediates, mind you, there are many other things that it bioremediates. The first thing that came up was TNT, explosives. So salmonella bioremediates explosives. Now, obviously, that's not going to be one of our main toxins. But my point is, who thought that this so-called awful, avoid this thing at all costs bacteria actually has a bunch of positive effects potentially? So there is that. And I think that that's going to be critical in developing the terrain theory, understanding bioremediation and transformation. So the other cool thing is that it's clear to me that this whole orchestration of change of bacteria may not be bacteria alone. It actually might be neurally mediated because there is this weird thing in studies where they found that if you get a head injury, your microbiome changes within 2 days.
Yeah.
Now, how would it do that? Why would it do that? Well, it could see any kind of head injury as a threat. So threat systems increase. It goes towards a pathogenic type bacteria in the gut.
Sure.
I believe that my belief at this point, and I might be wrong, and I'll be happy to be wrong, is that the vagus nerve determines what bacteria are in the gut. That's what determines it. Everyone's like, the gut to brain axis, like the gut's communicating with the brain, and then the brain changes because what's in the gut. I'm like, no. It's the brain to gut axis. The brain determines what's in the gut. The brain says, no, this is not right. We need this bacteria. Please change. And it has a conformational change towards what's appropriate at the time. And I think that's probably more likely because it makes more sense. It's kind of like we're still at the burden of these bacteria if they're constantly controlling us. I don't believe that. I do not believe that in any way. The other interesting thing is that, so you cut the vagus nerve and then the effects of gut bacteria on the brain are gone. Now, I think they misread this stuff. I really do. I think so. When you give someone certain bacteria in these studies, right, and they put them in their gut, it's not all they put in there, right? Remember, these studies done with viruses, they put all other kinds of crap that cause symptoms that may not, and probably just detox anyway. So they put this into the gut of animals, then they cut the vagus nerve, and the animal doesn't have the cognitive mood changes that an animal would have if the vagus nerve was there. So, for example, this rat gets no vagotomy, no loss of vagus nerve. They put something in their gut and they get depression, or at least they sort of rat-type depression. The next rat cut the vagus nerve They put the same stuff in the gut and they get no depression. I mean, what does this really prove? I mean, it doesn't mean it's very hard, like, because it suggests that depression is bad, firstly, and that somehow depression is like a disease state in these rats. But it actually might
Yeah.
be that it's reducing their, like, it's making them less wanting to move, so they can actually help with elimination of whatever they've got in their gut that actually they've introduced. Because the likelihood is they've actually introduced a bug plus a bunch of other toxins in that solution. So
Absolutely.
these studies
Yeah.
aren't very helpful, but I do think that the head injury causing change in gut bacteria is very informative. I think that's very interesting. And there are some preliminary studies being done that I've met some of the researchers showing that when you do vagus nerve stimulation, your gut bacteria changes towards so-called beneficial bacteria. And so the way I would say envisage the gut bacteria is you have certain gut bacteria that are really good at producing nutrients, that are really good at kind of like farming. We call them the farmers. My analogy is like a medieval keep, right, or castle. Outside the castle are the farmers. They're there ploughing the fields, producing what the kingdom needs. Invader. They come inside the keep, and out come the soldiers. But these soldiers, they're a little bit bruisey. They're a bit violent, but they're really good at killing off this thing coming in. Not meaning pathogen, meaning toxin. And they do that job, right? That's their role. But in the meantime, a lot of these sort of other things like nutrient absorption, things like that these other bacteria do is kind of put to the side, because the main thing is we got to protect the host, got to protect the
Yeah.
kingdom. And so I still don't think that they cause disease. I think that the absence of the good bacteria is a problem, because it means we're not producing the same amount of nutrients or whatever else is going on. We don't really fully understand. And you talk about vitamins, so it's all up in the air now with Daniel. So I think they're still defensive. I think that's what their main role is. And I think I'm putting together a list of toxin and all the different bacteria. Toxin, bacteria.
Wow.
VOCs are being listed in a lot of them. Uh, Particulate matter, plastics, the list goes on. So I think it's pretty cool. And it's going to be the next big thing, I think. But everyone, like anything in this world, I think everyone's going to come to this conclusion in the field, which they already are, um, that we need this list so that we can then better remediate and possibly use the bacteria to our own advantage.
Yeah. Agreed. Yeah. I couldn't agree more. And you laid that out beautifully. That's awesome. Phew, we're gonna need to do part two.
Oh, yeah, I think people just misunderstand diarrhea. I if you get it, go great. I'll drink some more water. I'll have some more salt. I'll have some more good nourishing foods.
Yeah.
Um, I think it's very hard these days. I think our food is laced with toxins because of the synthetic fertilizers. I think because
Yeah.
the soil is depleted of the bacteria, so therefore the heavy metals are getting into the foods. I think that meat is probably the cleanest food. I don't hold me to that, but I favor carnivore and fruit, meat and fruit. That's my favorite two foods that I'll go to. I feel better on them. Not sure why, other than my biased beliefs. But I have a sneaking suspicion that vegetables, nuts and seeds and grains are probably they're not the best. They're not how they used to be.
Yeah.
But it's just. But then on top of that, I think that it matters how you eat. How slow you eat. Are you with friends and family? Are you isolated? Things like that. I think these all play in a lot. And it's very hard to say it's one thing. People like to do that. They're trying to isolate one cause of one thing, but it's
Yeah.
and like you've said in some of your videos, you've just lost contact with nature, and I think that is a big part of it as well. Like, look at me; I've got like devices everywhere here. Like, it's just an electronics room. Um, and we do feel better when we're moving. We do feel better when we're
Yeah.
dancing. My actual background is ballet. I used to be a ballet dancer with the Royal New Zealand Ballet Company, and I completely understand what it's like to get joy out of movement. That's why most
Yeah.
dancers continue the day in day out slog of destroying your body with ballet, is because they do love it.
Yeah, true.
And sometimes
Yeah.
a lot of dancers are smokers and heavy drinkers and drug users, unfortunately. And yet still they can be really healthy. I don't know how this is possible. I think there are a lot of things that can make us so-called healthy, whatever that. Like I said, I don't know what that really means anymore. Um, but for me nowadays, I do my best to eat organic.
Yeah.
99% of what I eat is organic. I drink distilled water. I try
Mm.
100% clean. I don't, the minerals, I've read Andrew Kaufman's videos on mineralization of water versus distilled, and I think that's pretty compelling. So I don't think the need is there to have mineral water or mineralized water. Um,
Interesting.
the air is always really tricky to clean. I have air purifiers. It's tricky. Being active every day, try your best, get sunlight. These are the main things if you can do that. And also don't obsess about your health either. If you obsess
Yeah,
about
it's a
it,
good point.
you can create problems. Like I can tell you now, there are some patients there they are not you cannot fix them. They are convinced they're going to die. They're convinced they're unwell, but they're not. They're actually just detoxing or just doing normal things. They've exaggerated the catastrophized, unfortunately. And that's a sickness in itself. So we've
Yeah.
got to be careful about being too obsessive. Just live your bloody life.
Yeah. Amazing. Yeah, well I, listen, I couldn't agree more, man. Like I think you're hitting the nail on the head here with everything today. I think this was fantastic discussion. Um like I said, we're gonna have to have you back on. I want to go for another hour and a half right now.
Yeah, yeah, yeah. I've
But
got, for sure. Sounds good.
yeah, yeah, we'll definitely line that up again. Now, I want you to tell the listener how they can help support you, how they can find what you're doing. You know, just whatever's best for you.
Okay. Yeah. So my website is just emrysgoldsworthy.com.au. I live in Australia. Beautiful country. Highly recommend it. And I wrote a book. Now, this book is called The Vagus Nerve Unleashing the Body's Secret Weapon Against Disease. And in this book, I
Mm.
use terminology that's for the mainstream. I don't use new biology terrain terminology per se, although there is a sneaky section on detoxification, which I added in there to sort of just throw people once they get to it. And it talks about what we've done. We've gone through a lot of that today. But in it, it explains the vagus nerve from a medical perspective, from kind of a functional perspective, and it goes into detail about it, like almost too much detail. It's not light reading. It's a great reference text for a clinician, but it also goes through some of the protocols I use to improve heart rate variability, improve vagus nerve tone, and it doesn't go into detail in all the hands-on face-to-face therapies because that's what clinician training is all about. So I do clinical training with people as well, for people who range from physiotherapists to doctors to psychologists have done my training. Any number of people, and it does depend on your field as to how much you can do of it. Some of it's hands-on therapies. Some of it's the thing called transcutaneous auricular vagus nerve stimulation. It's electrical form of vagus nerve stimulation, and it's very effective. It's where most of the studies. We didn't talk about that today. We can do that another time if you want. But you learn that in the course. So on my website, I'm running a 3-week cohort, a 3-week course in late March. And there'll be some live videos and descriptions of everything of how to do all things that I do. And every field will have kind of a slightly different take on it because from their perspective, they see these problems. From this person's perspective, they see these problems and so on. And yeah, we get all number of people. I even have had dentists do it, interestingly. Yeah. And
Oh,
people were involved in speech pathology, which makes sense because a lot of the speech issues that people deal with are vagal. I'd love to talk to speech pathologists more because I have a feeling that vast majority of their problems are all vagal. Hence why a lot of these speech problems come about from stress. That's another
wow.
topic. It's too
Yeah,
many. So I didn't get to everything in the book because there's just too many things, you know.
sure.
But additional to that, I am doing as many podcasts as I can to get the word out. And I run a Facebook group under the same name as my book. So check that out. That's my way to contact and communicate with people through the name The Vagus Nerve Unleashing the Body's Secret Weapon Against Disease. That's a Facebook group. Look for that. And on there, we just basically talk about the vagus nerve. And there's a lot of people who just aren't ready to accept the terrain theory. They're just still in the belief that their problems are caused by COVID, by other bacteria, Epstein-Barr, all sorts of other things. It's always a microbe, I tell you now. And it just ain't. Just ain't. There are so many other things that cause their disease. And, I hope to convince people eventually. So they're the main
Yeah,
things. And I
amazing.
do work clinically with patients in Australia and internationally.
Awesome. Well, I think you're doing a good job so far, to be quite
Thank
honest with
you.
you. Yeah, amazing. All right. Thank you so much for coming on. I really appreciate
All
it.
good. Thanks for having me.
Yeah, certainly. Yeah. All right. I want to thank you all for listening. You should all know that's not medical advice. This is for your informational purposes only. But remember, we're all responsible, sovereign beings capable of thinking, criticizing, and understanding absolutely everything and anything that comes our way. We, the people in the greater forest, are together self healers, self governable, self teachers, so much more. Reach out if you have any questions, comments, criticisms, concerns. You know where to find me. If you enjoyed the podcast or found it informative in any way, give us a like, comment, share, whatever you got to do. Um, and I hate ads on podcasts more than anything. And I don't ever want to put ads on my podcast. I may promote my own stuff, but I will never ever put ads on it. So I did actually create a little donation platform, Buy Me a Coffee. The link's down below if you guys want. It's absolutely not necessary. But if you do, all proceeds will go directly into my vision, like our vision here at Beyond Train. Um, so yeah, I'd really appreciate that, but not necessary. I want to get this information out here too. I love talking about this stuff. I really enjoy doing the podcast. So I love it. It'll always be free and ad free. Um, so that's great. On that note, there are two types of people in the world: those who believe they can, those who believe they can't, and they're both correct. Thanks for listening, guys. Take care.